Over 240,000 women will be diagnosed with breast cancer this year. About 15 to 20% of these breast cancers will be triple-negative breast cancer. Triple-negative breast cancer occurs most often in young women and women of African American descent.
Well, there are many challenges associated with triple-negative breast cancer. I think people should keep in mind that we didn't even think about triple-negative breast cancer as a separate entity until somewhere in the range of 5 to 10 years ago, and that the fact that we talk about triple-negative breast cancer is really a result of much research that has occurred over the last 2 decades. Triple-negative breast cancer is a subset of breast cancer. It accounts for about 10 to 15% of all cases of breast cancer in the United States.
Triple-negative breast cancer, compared to other subtypes of breast cancer, carries a worse prognosis. But what that's to say is that we don't have as many treatments for it outside of chemotherapy. It also is important to note that although compared to other subtypes, triple-negative may have a worse prognosis, most triple-negative breast cancers are still cured by conventional therapy, chemotherapy, and the surgery and radiation that's appropriate for any breast cancer patient. The difference between triple-negative breast cancer and other subtypes of breast cancer is that triple-negative breast cancer doesn't have ER, PR, or HER2, the proteins that we have targeted therapies against for breast cancer, which means that we can use chemotherapy to treat it, but we don't have any other targeted therapies at this point.
In terms of who gets triple-negative breast cancer and who's most affected, I think that the one thing that people have to keep in mind is that it can affect any woman. That said, there are some groups of women who seem to be more susceptible to triple-negative breast cancer. Triple-negative breast cancer is somewhat more common in younger than in older women. There are data that would suggest that it's more common in women of African ancestry, particularly African American women. And finally, triple-negative breast cancer is something that occurs in women who have what are called BRCA1 mutations.
Triple-negative breast cancer is generally diagnosed the same way as other breast cancers, either through mammography or through either a doctor's exam or a self-examination. Triple-negative tends to crop up a little more in what we call interval cancers, which are between mammograms, but that doesn't mean that mammograms don't work in triple-negative breast cancer. From the treatment standpoint, the main difference in triple-negative breast cancer is that we're really reliant on chemotherapy to treat it. The good news is that advances in chemotherapy have, if anything, benefited this subtype as much, if not more, than any other subtype. So we're actually getting better at treating it than we were a few years ago. But we're really reliant on chemotherapy for treatment at this point.
Nancy Blagzina is the honorary founder of the Triple-Negative Breast Cancer Foundation. Nancy was young, vibrant, and beautiful when her triple-negative breast cancer was diagnosed at the age of 35. She was a wife, a mother, a daughter, a sister, and a wonderful friend to many. It was this strong bond of friendship that led to the creation of the Triple-Negative Breast Cancer Foundation in 2006, just a few months before Nancy passed away. Breast Cancer Foundation's mission is to support research into the causes, diagnosis, and the treatment of this type of breast cancer, and to provide programs and services to the triple-negative breast cancer community.
Since our founding in 2006, we have had a tremendous response from the medical community. Through our annual Triple-Negative Breast Cancer Symposium and our co-funding of a multi-million-dollar, multi-institution research grant, we have already had an impact on the research agenda. In addition, we collaborate with other organizations to create programs and resources for women and their families who are struggling with a triple-negative diagnosis and treatment. The foundation has experienced incredible growth since its inception. We now have a presence throughout the U.S. and even internationally. Our website is the destination for information and resources on triple-negative breast cancer, and we have over 3,000 people visiting our online forums to communicate and receive support from each other. And we have hope.
For any woman who's been diagnosed with triple-negative breast cancer, I always tell them, do not fear. We have to be hopeful. We know that many women are surviving triple-negative breast cancer, but the challenge is we cannot tell who is going to survive and who's not. And that's why it's really important, the work that the Triple-Negative Foundation is doing to support research, to bring in new drugs, to bring hope for all women who are diagnosed with triple-negative breast cancer.
It is so important for groups like the Triple-Negative Breast Cancer Foundation to raise funds and provide those funds to investigators doing work in triple-negative breast cancer.
There are lots of organizations that ask for your money, ask for your time, ask for your energy, devoted to cancer and indeed even to breast cancer. But only the Triple Negative Breast Cancer Foundation focuses on this very aggressive form of breast cancer. Only this foundation puts its time, energy, and efforts to treating this very dangerous disease. And because of this, only the Triple Negative Breast Cancer Foundation can bring the energy and passion that will allow us to treat and eventually cure this disease.
Between 20 and 30,000 women will be diagnosed with triple-negative breast cancer this year. Triple-negative breast cancer does not discriminate. Our hope for the future is that every woman of any race or walk of life will be able to have effective treatments and supportive resources available if she has triple-negative breast cancer. The Triple-Negative Breast Cancer Foundation is the only organization completely dedicated to helping people with triple-negative breast cancer. With your help, we are making a difference and saving lives.